For the maxillomandibular relationship recording procedure, the instruments and materials required are the Bunsen burner. You have this Fox plane to help you guide to get the occlusal plane. Of course, the indelible pencil, the Lacron cover, wax knife, and then this is the caliper, or sometimes they call the divider, and the metal ruler, okay, cutter, and this is a trowel. This is used to trim down wax. You warm this instrument, and then you reduce the wax by smoothing over the wax ring. Other things that you need is the recording material, and this is the adhesive for the recording material. You have the wax, modeling wax, and also the shape guide. Towards the end, most of the time, people take it towards the end of the procedure, but you can also take the shape guide at the beginning of the procedure. And very good morning or good day to everybody. Today we are going to show you the maxillomandibular relationship recording. But before that, I would like to remind of our previous procedure, that is the secondary impression recording. So here we have the cast. This is the secondary cast or the master cast for the maxilla and the mandible. As for the cast, the one thing that we need to do about the cast is the trimming of the cast must be good. So I would like to show here about the trimming where the base is flat, horizontal, and it should be roughly horizontal to the ridge as well for both the maxilla and the mandible. The side of the cast must be smooth, and you can see here the land area must be trimmed down and smoothened. You must have also land area on the posterior. So you have the hamular notches over here. Likewise, the mandible. The cast must also be smoothened at the side for the mandible, and the thickness of the base of the cast should not be too thin, or else it will fracture. When it drops or too thick, it will be difficult to mount onto the articulator. So it's roughly between 15 to 20 millimeter. So that's for the trimming of the cast. So on this master cast, we would want to construct occlusion rim. Here I want to show you the occlusion rim that has been constructed for the maxillary master cast and also the mandibular master cast. So for the maxillary master cast, we have constructed the base of the occlusion rim in acrylic resin, which is light cured, but you can also use other materials such like the heat cured acrylic resin or the cold cured acrylic resin. The rim is made of wax. Also for the mandible as well. The next important thing that we must bear in mind is the placement of the wax rim on the bases. This is very important because you find that if the placement of the wax rings are correct, then you find that your maxillomandibular relationship recording stage will be will take it very short. It will not take a long time to do the trimming in the clinic. So let's do the maxilla first. Okay. For the maxilla, where do you place the wax rim onto the base? There are a few guides here. For the maxilla, we use the incisive papilla as a guide. Okay, use the incisive papilla as a guide. And also another guide is the remnant of the lingual gingival margin. You can see here a cord-like structure over the residual ridge. Okay, let's talk first regarding the anterior rim. So the anterior rim, when you place the anterior rim, it should be about, so this is the incisive papilla, okay? It should be about 8 to 10 millimeter labially. So you can roughly measure and make sure that the rim is roughly about 8 to 10 millimeter for the anterior. As for the posterior, this lingual gingival margin serves as a guide to place the wax rim, because this is the position where the teeth were before, yeah. Because the resorption of the posterior part, you find that is occurring more from the buccal, not so much from the palatal. So when we want to set up the teeth, it has to be where the teeth were before they were extracted. So meaning that the rims has to be placed more buccally. And the trimming of the rim for the occlusal plane should be flat and roughly about 20 to 22 millimeters, but that's just a rough estimation. The actual one will be when you place this rim into the patient's mouth, and then you can check for the labial fullness, whether the patient has got thin lips or long lip, so you have to adjust accordingly. So it should be maybe the occlusal plane may be lower or maybe higher. And on the posterior, the rim should be sloped this way. It should not be up to the hamular notch, it should be sloping towards the hamular notch. That's for the maxilla. Now we come to the mandibular master cast. So over here I've drawn on the crest of the ridge a line, okay, on the crest of the ridge to the retromolar pad and up to the land area, okay, for both sides. So now for the mandible, the placement of the wax rim for the posterior must be on the ridge. So you can see it's on the ridge for both sides. And for the labial, it should be placed slightly labial to the ridge, and the final adjustment should be done clinically, yeah? How far labial. But also the most important thing is to make sure that the patient has got enough tongue space. Okay. Again, you can see here, I would like to stress again about the placement of the rim for the lower. It has to be on the bridge posteriorly and slightly labially for the anterior part. Now the patient is being seated onto the dental chair, and we have taken out, the patient has to remove the denture and place it in this cup filled with water. So before we can start anything, we must make sure that we check inside the patient's mouth. Buka, eh? Lampu. Okay, check inside the patient's mouth to make sure that there is no ulcers or any other lesions. Okay, check inside the patient's mouth. Okay, okay. Then we can proceed with the maxillomandibular relationship recording. Once we have checked intraorally that the patient's mouth is healthy, there's no ulceration and so forth, now we would like to check the occlusion ring inside the patient's mouth to see if there is any overextension or maybe it's loose, so we need to do some adjustment. Buka here. And we put in the upper rim, the maxillary rim, inside the patient's mouth, and then check. So if this is okay, yeah. Right, that's okay for the maxillary rim. But if you find that the rim is loose, so you must check for any overextension that you need to trim. Yeah. As for the lower, put it in. Check also for the retention and stability for the mandibular occlusion rim. Okay. Yeah. Angkat lidah lagi. Okay. Yeah. It's okay. It's stable. Yeah. Again, if there is any overextension, then you need to do the proper adjustments that is required. So I'm using now a trowel. Hit the trowel and then melt down the wax. So this is really an estimation, and with practice you find that you'll be able to adjust or trim accordingly. So just now it was showing about 3 millimeters. So now we want to reduce it further. So we just need to put the down and the wax this way. Then you can then place back in the patient's mouth. So after trimming the wax, I place back the occlusion ring inside the patient's mouth and check again the level of the occlusal plane. Relax nanti. Biasa ya. So you can see that it's okay now. Yeah, it's okay now. It's showing roughly about 1 to 2 millimeters, so it's okay. Then we can check again the level of the occlusal plane to make sure that it's parallel to the alar trigger line over here. Yeah, so that's parallel, right? And also for the anterior is parallel to the interpupillary line. Nanti buka mata nanti. Okay, it's parallel to the interpupillary line. Alright. For this procedure, when you position your patient on the chair, you must make sure that the alar trigger line or the campus line should be parallel to the floor. Then you can, and the head should be upright as shown here. Inside the mouth. As you can see from here, after I trimmed the occlusal plane just now and placed back the rim inside the patient's mouth, I found out that the rim is stooping more onto the patient's right, because you can see the distance from this marking to the box plane and the distance from here to here, you find that this is more. So meaning that it's stooping towards the patient's right, meaning I have to trim on the right to make sure that it's the same, the same distance. So now I'm going to adjust on the right side. So I've already adjusted the patient's on the right side of the patient, the occlusal rim. Yeah, and then now you can see that it's parallel, posteriorly parallel to the alar trigger line on both sides, and then anteriorly is parallel to the interpupillary line. Nanti buka mata ni. Mata tengok dia tu kan. Okay, it's parallel to the interpupillary line. So the upper rim adjustment is done with the proper labial support and the level of the relax. Okay, tutup mulut sikit. Relax, the occlusal rim. Yes, nanti relax now in the correct position. That is parallel to the interpupillary line and also the iliacal line. Okay, now we can proceed with the mandible. Okay, nanti buka ya. Can put in. It is difficult to put in the mandibular occlusion rim. Remove the upper first and put in the lower. Nanti tutup sikit mulut ya. Okay. Alright. Alright. Then put in the upper. Now you have to adjust the lower occlusion rim according to the upper. So now you can ask the patient to close. Okay, tutup nanti. And you find that the patient cannot close because the occlusion rim on the posterior is obstructing. Meaning you have to make adjustment for the lower occlusion rim. Before we proceed with the next stage, we would like to find out the patient's resting vertical dimension, because once we trim the lower rims, we want to trim it at the occlusal vertical dimension. So now we need to get the resting vertical dimension. Yeah, relax, relax. Okay. So you have the 2 points here. Then you adjust the screw on this divider and get this measurement. Okay. Okay. Relax lagi. So make sure the patient's relaxed. Measure a few times. Buka sikit dulu dia. Relax rapat sikit saja. Lightly touching. Okay, that's good. Okay. Alright. So this is the measurement. Okay. Nanti okay. Do a few times. Okay, relax lagi. Relax lagi. Okay, just relax. Bibir sikit touching. Alright, sikit lagi. Just lightly touching really, lightly touching. So you get this measurement. So this is the measurement you've got. So you can actually measure onto the ruler and take note of the height. Just now we placed the lower occlusion rim, and we find that the posterior areas were obstructing the closure of the mouth. So now we need to remove the wax on the posterior. So the same thing, heat up the trowel here. Okay, and then trim down the posterior. Okay. Trim down. Okay, trim down the posterior lightly. Then remove the excess wax. Then you can place this back inside the patient's mouth. In placing the rim, the lower rim, so remove the upper rim and put in the lower. Put inside the patient's patient smile, upper rim now, and ask the patient to close. Tutup nanti. So you see that the space is smaller, but there is still obstruction on the posterior. So you will need to trim some more of the wax until the upper rim and the occlusal rim touches evenly throughout, and you get the occlusal vertical dimension. So just now I have trimmed the occlusal plane for the mandibular occlusion rim, and it's almost touching, yeah, over here. But you find that on the labial it's over supported. So what I'm going to do is I'm going to now trim on the labial portion of the wax rim in order that you get a properly supported lower lip. Okay, we have done all the adjustment on the occlusion rim with the labial support, the occlusal plane for the maxilla, and also for the lower. Now we have the rim coming together. Okay, tutup nanti, tutup ya. Okay, and you can see the rim tutup rapat nanti in close proximation with one another, the maxillary and the mandibular rim. And when the patient is close this way, we measure the occlusal vertical dimension. Okay, bibir rapat sikit nanti. Sikit je. Okay. Now we measure. You can see the difference between the tip of the divider and the marking. That's roughly about 2 to 3 millimeters, and that is the freeway space. Okay, that's freeway space. After this, we need to mark a few lines, guidelines. One is the midline. Okay, now we can mark cut me out with the okay, cut me here. So the midline is the midline of the face. Okay, so we mark, stand in front and mark the midline. Okay, and also must extend the line, the marking to the lower rim. After this, we need to mark the inner canthus and ala line for the position of the canine. So now we remove the patient's spectacle. So we have this inner canthus. Okay. Alright, and then we then draw the line for the upper. Is it correct? Yeah, okay. Then usually it should coincide with the corner of the mouth. Okay, and then we go to the other side and do the same. The inner canthus to the ala, and then we mark the line here. Okay. These two lines will tell you what the breadth of the anterior teeth, acrylic teeth. And now you want to get how high the patient smile. So you can see here the patient's smile line to be marked. Also another line over here to get the patient smile line. Okay. Then you know the height of the teeth that you should select. After this is done, we then record the retruded contact position using the recording material. So just now we have marked the midline. We've marked the midline, the canine line, and the smile line. Now I want to show you how to prepare the trough and the V notches for the recording of the retrograde contact position. So over here, behind the canine line, we mark roughly 2 lines here, roughly about 1 cm apart. Then you can make a trough for the lower. Okay, make a trough for the lower. Remove the wax over here. Make like a box. Okay. For the upper, between those 2 lines you mark, make 2 V notches. Make not to be a deep one. That. Okay. Right. And over here I've already prepared for you. Then when you put the 2 rims together, the occlusion rims together, make sure that the heels does not touch each other. Okay, the heels of the master cast does not touch each other. Show that, and that those V notches are within the trough. So after this, we're going to insert these occlusion rims into the patient's mouth and record the retruded contact position using material that we're going to place inside these prepared areas. The material we're going to use today for recording the retruded contact position is the vinyl polysiloxane bite resistant cream, or they call it Exabite. And when you use this material, you need to use adhesive. So I'm going to show you the adhesive here need to be placed onto the box and the trough only, because you need to separate out the rims. So just put on the lower, but you want the material, this material to stick onto the lower rim.
Okay.
Now we are ready to record the retruded contact position. I've placed the lower rim with the adhesive in the trough area. Now I'm placing the upper rim inside the patient's mouth, and then I'm guiding the patient to close in the retruded position. Okay, nanti tutup nanti ke belakang. Okay, now we close. Okay, alright. Now we can place the material. Okay, my assistant is going to place the material inside into the okay, and on this side. Okay. Alright. Okay, thank you. So you can push the material into the area. Tutup sikit lagi, sikit lagi. Okay, sikit lagi. Jangan buka ya. So this material sets very fast. So you have to make sure that when you do this procedure, you have to do it very fast. There are other recording materials that you can use. You can also use a zinc oxide eugenol material. Okay, zinc oxide, you know, like impression material. You can also use that if there is no more of those polysiloxane material. Okay, so now it's set, then you can remove. Okay, you can remove. You can separate it out, or you can, okay, like that. Oh, some came off. So when this thing came off, you need to redo the recording. Okay, because some came off, so you need to modify a bit, and then you need to record again. Yeah. Okay. We repeated the recording just now because on one side it came off. Okay, open, buka, tutup nanti. And this is the result of the second recording. So we got it already here. Yeah. Okay. This one. And you would want to actually remove the scalpel. Okay. Remove the excess material over here. Yeah. Here, remove the excess material over here. Right. Also on the back here. And then you want to place back inside the patient's mouth to check for the recording again. So place back this inside the patient's mouth. Okay, you have to remove the upper because the mouth opening is very small, and I'm going to put the Vaseline at the corner here because you want to injure the patient's lip. So put the lower with the recording material there. Okay, okay, and put the upper mouth, and then check again if this is the correct one. So again, you find that the patient open, yeah, buka, the patient couldn't close at the most retarded position, meaning that you have to remove again and re-record the occlusion again.
Bite on your teeth, bite hard, huh? Bite hard, bite, and don't let go. Okay, very nice. I think the posture juga lah. Kan? Learn lah.
Okay.
Normal.
So just now we have made another recording, and this time the patient is able to give back the retarded contact position, yeah, in the same place. So what we did just now was we placed the recording material onto the lower occlusion rim and guide the patient into the retarded contact position. After recording the retarded contact position, and we've got the correct one just now, yeah, we now place the occlusion rim onto the master cast and approximate them. Make sure that the heels does not touch, okay? Because you need to mount it onto the articulator. Like here, there is a very small space. So what you need to do is you need to trim down some more. You need to trim down some more the model and make sure that it's clear. This is very important. Okay, make sure it's quite clear there. Okay, not too bad. Yeah. Okay, this is definitely okay. Okay. In some cases, you may want to use a Facebook transfer because you would like to know the relationship of the maxillary arch to the terminal hinge axis. So this is how you do it. You need, at the same time, you need to put adhesive onto the bite fork. This is a bite fork, yeah, the bite fork. You need to put adhesive over this. And you can see here the bite fork, there is a marking there which indicate the midline, so that you can place your occlusion rim onto the bite fork and directly onto in line with the midline of the occlusion rim. Okay, this way. So if you see at the back, there is it's curving this way. So this is not the right one, the right side. This is the correct side because it's curved this way. Yeah? Right. So now we need to use again material to place the maxillary occlusion rim onto the bite fork. So I'm using this vinyl polysilane material again. So you need to press it in here and make sure you don't mess up the midline. Then place it over this way. Okay. Right. And then, yeah, and ready to set. Okay. Now we place the rim together with the bite fork into the patient's mouth this way. Yeah. Okay. And then we have the face bow. So we have the earpiece into the ear. Okay. It's a slight magnetic face bow here. Okay. Okay. Okay, dear. Sakit mana tak dia? Okay. Alright. Okay, dear. Okay. Now you put on your nose support, the nasal support. Okay. Okay, this is the nasal support. Then we use the joint pieces. Put in this inside the handle of the bite fork, making sure that the rim is always inside here. Then we have this other joint piece we place like this. Okay. That. Make sure this is in place, the nasal support is there, and you need to screw and tighten up, and always making sure the occlusion ring is in position. Screw this. And then also the reference point here. Okay. So this is how you do Facebook transfer for your complete denture patient. And after this, we need to. So this is the reference point. Okay, you have the nasal support reference point here. So everything is in order. This is already tightened. The rims, the occlusion ring is in place. So now we need to just tighten the parts. Yeah. Okay. So once this is done and we are satisfied with the Facebook transfer recording, now we can just remove the reference point. Yeah. Then okay, remove one, and then we can take out the cut. All right. So now it's out from the mouth. And make sure that you check that the occlusion ring is in the middle. Before we send home the patient, after completing the maxillomandibular relationship recording, we must also select the tooth shape for the patient. The patient may select shapes that is not really suitable for them, and we must advise the patient to select a shape which is suitable for Asian patients, and normally we would use the A3 shape. This is usually used for Asian patients and the elderly ones, because it is quite yellowish in color. That is other instrument that is required during the maxillomandibular relationship recording is a face bow. So this is a face bow. This happened to be the cable slide-matic face bow. You can slide and adjust here, and you can lock over here. You have the earpiece. Then you have the nasal support, where you can put on the top part of the nose. Yeah. Then you have the reference point here, and other accessories. You have the bite fork and the joint pieces.